Hey everyone, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about what are the risk factors for diabetes. So, if you like the video related to my health, my way, I would like to request you all please do subscribe to the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Risk factors for type 1 diabetes are not as well understood as those for type 2 diabetes. Family history is a known risk factor for type 1 diabetes. Other risk factors can include having certain infections or disease of the pancreas. Risk factors for type 2 diabetes and prediabetes are many. The following can raise your risk of developing type 2 diabetes: being obese or overweight, high blood pressure, elevated levels of triglycerides, and low level of good cholesterol, increasing age, polycystic ovary syndrome, impaired glucose tolerance, insulin resistance, gestational diabetes during the pregnancy, ethnic background, Hispanic, Latin Americans, or African Americans. Now, what are the different type of diabetes? There are two major type of diabetes called type 1 and type 2. Type 1 diabetes was also formerly called insulin dependent diabetes mellitus or juvenile onset diabetes mellitus. In type 1 diabetes, the pancreas undergoes an autoimmune attack by the body itself and is rendered incapable of making insulin. Abnormal antibodies have been found in the majority of patients with type 1 diabetes. Antibodies are proteins in the blood that are part of the body's immune system. The patient with type 1 diabetes must rely on insulin medication for survival. Now, what is type 1 diabetes? In autoimmune disease such as type 1 diabetes, the immune system mistakenly manufactures antibodies and inflammatory cells that are directed against and cause damage to patient own body tissues. In person with type 1 diabetes, the beta cells of the pancreas, which are responsible for insulin production, are attacked by the misdirected immune system. It is believed that the tendency to develop abnormal antibodies in type 1 diabetes is in part genetically inherited, though the details are not fully understood. Exposure to certain viral infection, mumps and Coxsackie viruses or other environmental toxin may serve to trigger abnormal antibody responses that cause damage to the pancreas cell where insulin is made. Some of the antibodies seen in type 1 diabetes include anti-islet cell antibodies, anti-insulin antibodies, and anti-glutamic decarboxylase antibodies. These antibodies can be detected in the majority of patients and may help determine which individuals are at risk for developing type 1 diabetes. At present, the American Diabetes Association does not recommend general screening of the population for type 1 diabetes, though screening of high-risk individuals such as those with a first-degree relative, sibling, or parent with type 1 diabetes should be encouraged. Type 1 diabetes tends to occur in young, lean individuals, usually before 30 years of age. However, older patients do present with this form of diabetes on occasion. This subgroup is referred to as latent autoimmune diabetes in adults. Latent autoimmune diabetes adult is a slow progressive form of type 1 diabetes. Of all the people with diabetes, only approximately 10% have type 1 diabetes and the remaining 90% have type 2 diabetes. So that's all about the diabetes in this video. I hope you all liked it. So before signing off, I would like to request you all please to subscribe this channel with your loved ones so they can also get to know better. And one thing more, I prepared personally a small presentation for all of you guys that will be going to share in the description box below. You can check it out from there. So this is Kerry Anderson signing off. Please do take care of your health. We will definitely meet in the next video with my other content. Till then, God bless you. Bye-bye and take care.